Not sure what actually happens during a deep dental cleaning? In this video, we're breaking down the entire process of scaling and root planing, so you know exactly what to expect and why it matters. Let's get into it. Deep cleanings are recommended when gum pockets measure 5 millimeters or deeper, a sign of gum disease. Healthy gums typically range from 1 to 3 millimeters. If bacteria and tartar collect in these deep pockets, a regular cleaning just isn't enough.
They're often needed if you have lots of 5 millimeter pockets and above. So the little ruler instrument, we call it a perioprobe, if it's dropping down into your gums at 5 millimeters, 6 millimeters, 7 millimeters and above, and there is bacteria, tartar in the pockets, then you would need to get those pockets cleaned out, aka a deep cleaning. So let's watch what happens next.
Before starting, your dental provider will numb the area, either with topical gel or a local anesthetic injection, depending on your needs.
First, no matter which half they're starting on, they will numb you up, either with topical gel or local anesthetic, the injection. It just depends on your individual situation, which one will bring you to comfort. So you won't feel anything, right?
The first tool used is often an ultrasonic scaler, which uses a mix of high-frequency vibrations and water to break up and flush out plaque and tartar, both above and below the gum line.
Next, they will start the cleaning. It's usually lots of water, like you see here, although it's not the best visual because it's not that simple. It doesn't just spray out high pressurized water, but it does also vibrate. So this water scaler will use both high pressurized water and the ultrasonic vibrations to remove the plaque and tartar from below your gums and above your gums. So it's lots of water, but they will keep it all contained by using the suction, sometimes multiple suctions, a saliva ejector, and a high speed. There will be lots of suction noises. And
after ultrasonic scaling, your provider may switch to hand instruments to fine-tune the cleaning. This alternates the tools and gives your mouth a break from suction noise while ensuring nothing is missed.
And oftentimes the clinician will alternate back and forth between the ultrasonic water scaler and the regular hand instruments, which gives you a break from the suction and all those noises for a while they are hand scaling using the regular instruments, as you can see here. And you know the noise. Everyone knows that noise. Okay, so here's a clip of just supragingival scaling. This would not be a deep cleaning because they are not going under the gums. As you can see, it would be a fine cleaning if you didn't have any perio pockets. If your gums are healthy, there's no deep pockets to clean, so there would be no deep cleaning. That would be a regular cleaning like this, above the gums. However, if you have those deep pockets, then subgingival scaling is needed, aka scaling tartar from below the gums. Removing tartar from below the gums. And once they go back and forth a few times, they go back from the ultrasonic and then they go to the regular hand instruments, then the ultrasonic.
Once scaling is complete, they'll use tools like a dental explorer and floss to confirm all buildup is removed.
Confirm that they removed everything. They'll do a double check. They might use an explorer to recheck everything, as well as some floss. Floss helps confirm they didn't miss any spots. Sometimes they might even take an x-ray to confirm as well that there's nothing below the gum lines anymore. And then you're done.
After your deep cleaning, your gums are ready to heal. To support healing and prevent future buildup, brush and floss daily, consider using a water flosser, and stay consistent with follow-up cleanings. And that's what happens during a deep cleaning. It's all about removing bacteria, stopping gum disease, and giving your mouth a fresh, healthy start. Stay consistent with your home care, and your gums will thank you.